I look like Billy, the cartoon character with the big nose. What's up, guys? I'm gonna show you guys my experience of my nose surgery, my plastic surgery on my nose. My nose was broken, and how everything went. I recorded a few days after surgery when I got doctor visits, and at the end of the video, I'm gonna show you some pictures and have a full explanatory, like talking about how everything went, what to expect and what not to expect, and that's about it. So I hope you guys enjoyed the video. Got any questions, comment below. I'll be sure to answer them, and I'm out. Peace.
Yeah, I told you. That's what I do all the time.
Oh man, that's old time, bro.
How you feeling, bro?
I'm good.
All right. We'll see you when you get out.
All right.
I love you.
Love you too.
Okay, sir. So
How you feeling, man?
I'm good.
I want to see Dr. Chow.
Dr. Chow just left right now. He already saw you here.
He left me. He didn't even tell me. I want to tell him thank you.
Well, yeah, you're gonna see him tomorrow.
He's the one that did the procedure. I want to thank him for everything. He's a good guy, and I want to tell him.
He was fine. He went outside and talked to me. He's okay.
He could do a good job.
He did a great job.
Did he cut my ear?
No, he did not cut your ear. No. He told me he did not have to use your ear. He did say your nose was broken in 2 spots and he fixed it.
He said everything went great.
Everything went awesome. He just said for you to relax and wake up. You gotta just go to sleep for a little longer.
First day of nose surgery. My nose is just very numb. Bleeding. Got the gauze right here for it don't drip all over me. Alright, day 2 of my procedure for my nose surgery. Right now we're at the doctor's office. He's gonna take off the gauze, clean the side of my nose. My eyes gotten puffier since yesterday, but everything's going good right now. Took my pain medicine before getting here. I'll talk to you guys after I see the doctor. Just got finished seeing the doctor. He pulled some stuff out my nose. I don't even know what it was, but it hurt. I got a video for you guys. I'll probably play it after I show this video. It's pretty graphic, so if you don't want to see it, I'll skip like 3 minutes ahead of the video. Make sure you buy some Vaseline for your lips, because your lips are going to be very dry. And that's it for now. I'll check in with you guys on day 3.
The moment we start surgery, some people like to swallow a little bit more, but those people also tend to heal a little bit faster.
Oh yeah.
The other thing is this.
I feel that. It burns.
This burns?
Yeah.
You might be half numb right now, so this doesn't feel like the most amazing thing to you right now.
How was the sleep when you finished?
Yeah, you were, well, I mean, you were awake, but I don't think you were really aware of what was going on at the time. You asked me how it went. I told you it went okay, that everything went fine, and that I'd talk to you later. And when I finished, and you were like, okay, and then you're like, so how did it go? So I told you it went fine, and that I'd call you later.
I don't remember none of that.
And then when I finished,
You want to know what's crazy?
you asked me how it went.
When,
What's that?
when I was right there, they put the IV in me. When you guys rolled me into the surgery room, I remember seeing all the lights,
Uh-huh.
and I woke up. I don't remember you putting the. Did you guys put a mask over my face?
We gave you oxygen, yeah.
Yeah, I don't remember none of that. Like,
Remember, you were really nervous, and so we gave you some Versed before.
yeah.
It does tend to make you a little bit forgetful, so
So-
you have a little bit of amnesia during that time, which is actually good. Most
Yeah.
people don't want to remember
The
necessarily.
only thing I remember is you sliding me into the surgery room, and ever since that, I don't remember nothing.
Okay.
I just remember.
So I'm gonna cut a stitch, okay?
You get a what?
I'm gonna cut a stitch. I'm gonna have you hold this, okay?
Okay.
Underneath your nose in a second. I'm going to cut a stitch, and once I cut that stitch, I'm going to remove the stitch. That you might feel a little bit, and then I'm going to take out these splints in your nose. And I want you to tip your nose forward a little bit.
Okay. Does
You
it
okay?
hurt?
Me cutting the stitch shouldn't hurt much at all because it's not you. Just feel some
Oh
pressure.
yeah, I feel that.
Okay, now this is what you're probably going to
Oh.
feel. You alright?
Yeah, I'm good.
It's always the big guys, I'm telling you.
Nah, I don't. It's not
Tip
that.
forward. Tip forward just a little bit. And don't run away from me now. Breathe through your mouth. Relax. Take a deep breath. There you go. Doing great. Try to relax. Remember, it's not a weightlifting competition because your nose is going to swell a lot if you don't. Got a lot of swelling here. Okay, you ready?
Yeah.
Take a deep breath. Blow it out. There you go. You're doing great. Let me give you a tissue. There you go. You can just hold the tissue. All the bad stuff is done.
What did you pull out my nose?
I'll show you in a second.
Am I crying or what is that?
Hey, I told you to take some pain medication today because it does.
So today is day 4. I didn't record day 3 or 2. Just the day of my surgery, and then the day after my surgery when they took whatever the fuck was inside my nose out. But I didn't record the next 2 days because my eyes swelled up a lot and I was just pretty much sleeping all day for the next 2 days after the day of surgery and the day after surgery, if you get what I'm trying to say. Right now I'm in the drive-thru at McDonald's on my way to the doctor's in Arcadia to get the stitches taken out. Today is Monday, and Thursday I get the cast taken off. I'm feeling a lot better today. I'm still not on there, a little drowsy, but the hardest part so far I can say about the procedure and everything going so far is the recovery. I hate the recovery. I'd rather much be in the gym or doing something active other than laying down, sleeping all day, and that's about it. Alright. I'll see if I record. I'll take it off the stitches. Alright, just got done with the doctor. He took, I think 10 stitches out. He told me in total there's 20 stitches. He took 10 stitches out. He cleaned inside my nose with the Q-tips. I predicted right because I was going to clean inside my nose with some Q-tips by myself, but he told me that it's good that I did it so that he could do it because he could see inside my nose because he was leading me back. Clipped the stitches out, cleaned inside my nose, and he put some glue ointment in my nose right there where he put the tape right there. And he took some stitches out and he cleaned me up. So Thursday I see him again. He's gonna take off the cast, take off the rest of the stitches, total 20 stitches, and then after that I think I see him a week later or a couple of days after that, then that's it. But still bruised up. He said my cast was a little off a little bit, like a little bit, I don't know how to explain it. But everything's good so far. There's someone right here in front of me, that's why I keep on looking over there. But other than that, everything's going good. I hate it. I wish I could be at the gym, working out right now, or doing something. Alright, well, I gotta drive home, and I'm probably gonna go back to sleep. The reason why I talk like this is because I can't move this upper part of my face, just below here. So that's why you can only see the bottom of my teeth. Alright, deuces. It's Thursday. I'm here at the doctor's office in Arcadia. Today he's supposed to take off my cast and remove the last 10 stitches. In total I had 20 stitches. I think it was Wednesday he took off 10 and that's it. And the day after the surgery he took out some tablet thingies that were in my nose. I don't know what they're called, to be honest. The first thing that came to my head was tablets. That's why I said tablets. But I didn't know he was going to take those out the first day, the day after surgery. So when he took them out, I reacted kind of weird. Like I was in shock. I didn't know I thought he was just cleaning my nose. Well, anyways, I'm gonna go in there do you see what he does? If he does take off the cast and take off all the stitches, and he tells me that I'm good, but he told me I'm still gonna have to follow up to check on him, of course, in like a week or so after. But if he does, everything goes good, everything's taken off, I'm gonna sit down, talk to you guys for like 3-4 minutes straight about the whole week, how it went, the day of surgery, the day after, everything, just everything, how I felt, and how what to expect and not what not to expect. And I'm gonna sum up everything. I don't know if I'm gonna put in all the videos of day 1, day 2, because I skipped day 2, 3, and I think like 5. I think I just recorded the days of me going to the doctor check-ins. But I'm gonna let you guys know how everything went from day 1 to day 7, Thursday to Thursday. All right, catch you guys after the doctor's visit. So this is 1 week and a day after my surgery for my nose surgery, plastic surgery, whatever you want to call it. The reason why I got the nose surgery, plastic surgery, is because my nose was broken ever since I was little. I just never got to fixing it. It cost a lot of money too, and the insurance couldn't cover it. The doctor told me when he saw my nose, he says it was broken in 2 different spots. It was broken on the left side and the right side, and some bone on top of right here. I got some pictures I'm gonna show you. Probably at the end of the video. I don't know where I'm gonna put it, but you'll see them. So this is how basically everything goes. The first week before surgery, he told me that I can't smoke or drink. So I did as he said. I didn't smoke or drink the week before surgery. The day before surgery, you can't eat anything or drink anything after midnight, day prior before surgery. For surgery, you basically is and also you gotta get your blood test. Get a blood test a week before you have surgery. For they can know what blood type you are and all that good stuff for surgery. To make sure that you're capable and available to have surgery. And what was I saying? Okay, so for surgery, basically you go to the hospital that they tell you to go to. They give you the address. You show up. You sign in, and everything. They call your name. They take you to a little room. They have you put on a gown. They let me keep my shorts on and my socks on. You have to take off your shirt, put the gown on. If you have surgery, you know basically the stuff you have to do. So you get in the bed, they put you in. They have a doctor come, talk to you, tell you what's gonna go on. Then the IV person, no, the doctor, the nurse is inside there. They put the IV on your top of your hand, top of your, I was about to say on top of my palm, but yeah, on top of your hand. Put it right here, and there's nothing in the IV yet. My dad was with me at the whole time, and kept on telling the doctors I was nervous to give me medicine to calm me down and all this stuff. I was nervous, but I was fine with everything going on. And then the medicine that they gave me, it does actually calm me down. So if you do have surgery, I recommend you to tell your doctor you are nervous because it does really help. They put medicine in my IV, and then that's when the IV person comes and he tells me everything about what's about the IV and how they're gonna put me to sleep and I'm gonna wake up, how long the surgery is gonna be. My surgery actually took 3 hours. So they put the medicine in my IV, the one to calm me down, and when they wheeled me away to like inside the surgery room, all I remember is seeing all the equipment and all the lights, and boom, I woke up. I swear, I don't remember them putting nothing over my face to knock me out. I don't remember anything. I just remember waking up, and I was like, "What the heck is going on?" Right? And then, so surgery was honestly that bad. I was most scared about that. Like honestly, the IV when they put it in, it hurts less than a pinch. Like you don't even feel it. Basically, it's like a little scratch. So that's surgery. The worst part out of everything, I would have to say, is the. I'm just checking the time, how long the video is, because I don't want the video to be that long. The worst part of surgery is probably the recovery. The day after, I was just not the day after. The day of surgery, I was just super exhausted, drowsy. My eyes were heavy. I just wanted to sleep all day. My nose was super stuffed and like super itchy. That's one of the main problems in this. So when they put the cask over your nose is super itchy and you can't get to that itch. For the itch could go away, you just gotta deal with it. It's annoying. So basically, the first day I have videos for the first day, the second day, and I think I skipped like all the other days. I basically recorded only the first day and the days that I had a visit to doctors. I'll probably put those videos in before this video. Probably put this at the end. Day one, I was out of it. I was basically on medicine and like, I don't know. I don't remember that much honestly. I just remember laying in bed all day, and I got Jamba Juice. I kept on asking for Jamba Juice. Jamba Juice is a good go-to when you have the surgery because you're not gonna be able to eat anything hard or eat anything hot because your nose will run. It just Jamba Juice is a go-to, or pudding, yogurt, best options for week one. Day two felt a little bit better. I was all right. Oh, day two is like the day after surgery. The day after surgery, consider day two. I had a doctor visit. I went to see the doctor, and I actually recorded what he did inside. He told me he was just gonna. Yeah, I forgot what he told me. He said something. I probably said it in the other video, so I don't remember. But he told me he was gonna just look at me or check on my nose or something to make sure everything went up the day after, like went straight the day after. But I didn't know what he was doing. He said he was cleaning me up, and he pulled like 2 little tubes out of my nose. I guess I was keeping it straight overnight. I did not know he was gonna do that. I have the video for that. I am gonna show you guys, but it caught me off guard, so my reaction was kind of like iffy. Like, it hurt a little bit though. I ain't gonna lie. I think he took off some stitches too. Like I said, day 2 and 3, I didn't record nothing. I was pretty much in bed all day drinking Jamba Juice and just sleeping all day basically, because can't do anything basically because you're just out of it. You're on medication. And the third day, my eyes were really swollen. Like, your eyes are super heavy. Like, you just want to be in bed all day. Like, you just want to sleep. So my eyes were shut basically. I was just sleeping. Day 4, think I seen the doctor day 4. He took 10 stitches out of my nose. Total stitches I got in were 20. He put all my stitches on my left side of my nose, so my left side of my nose is the most swollen than the whole nose, but it's really swollen still right now. Day 4, he took stitches out my nose. 5, a little better, still kind of out of it, drowsy, sleepy. Day 6, at that point, I can't sleep at night because my nose is super itchy, and the cast right here that they put on your nose is just super itchy. I'm just constantly trying to scratch it, but you can't scratch it because the cast is on top. It just won't let me sleep. I'm up all night just not being able to sleep, and you gotta sleep on your back. I'm not a back sleeper. I'm a stomach sleeper, a side sleeper. I don't even use a pillow. I sleep on my arm usually, so very hard for me to sleep. Day 7, it was yesterday when they took off my cast, took off the last 10 stitches, and that's pretty much it. If I had to say the worst thing out of this whole surgery, I would have to say is the recovery. It's not great. And the doctor told me I can't work out for 3 weeks, and I am someone that loves fitness. I loves to work out. So that's a pain. I gotta wait 2 more weeks. This is the day after they took off my cast, so 1 week and a day. And that's pretty much it. Honestly, it's not bad. It's just something that I had to go through because I didn't like the way my nose looked. I'm gonna have before and after pictures posted up on this video. I don't know where I'm gonna put it in the video, but I'm gonna have some. Like I said, surgery wasn't bad. Recovery is awful because you're not able to do anything and your nose is itchy. I couldn't sleep. But time flies. I'm going to be happy later when everything looks good and ready. That's about it. If you guys have any questions, I'll be more than happy to answer them below. So just let me know on your questions and I'll be getting back to you. But other than that, that sums up everything. I'm gonna have the videos and the pictures posted on this video. Yeah, that's it.